Now, after 3 months fighting coronavirus, the region's hospitals are beginning to get back to some sort of normality. At the East Lancashire Trust, routine operations have started again, and a month after they first visited the COVID wards there, I'm sure you remember the series of reports, our health correspondent Gill Dummigan and cameraman Alex McCartney have returned. And here is the first of their exclusive reports, this time from Burnley General.
After a 3-month gap, the urological surgical team are starting to carry out routine procedures.
It's nice to see people getting back to a sort of normality now, and nice to see the old team back together.
Today they're removing Paul's kidney stones.
You get spasms, you get cramps. It can either come very, very painful, very nasty all at once, or it can build up. It's been going on a long time now, and it would be nice to get rid of it.
All right, thank you.
Emergency and urgent cancer surgery has continued throughout the pandemic, but many other operations have had to be delayed.
Inevitably, because of the reduction in theatre space we've had, the list have slowly built up. And it can take a little while to recover from that and get back to what will be a sort of new normal. We're in.
Because a lot of this team's operations are minimally invasive, they can go ahead.
We found your stone there, can you see it?
Hip and knee surgery is a different matter.
This is where normally we'd be doing lots of the orthopaedic surgery, but as you can see at the minute, that's not back up and running just as yet. Normally, this is one of the anaesthetic rooms that we'd have equipment in. So normally in here we'd have an anaesthetic machine and one in theatre, but at the minute they've all gone over to Blackburn.
At the height of the pandemic, efforts were concentrated at the main hospital, the Royal Blackburn, 14 miles away.
Initially everything got sent over there because all the staff and all the patients were over there, so we didn't need any of it here. And now as the numbers of patients for COVID have gone down, we can start to get back our anaesthetic machines and other equipment so that we can take some of the load back off Blackburn and start operating back here.
But it's not just equipment which ended up being moved out of this hospital. This time last month, most of the people in this room were over in the Royal Blackburn looking after COVID patients in intensive care.
You are worried for yourself, although I have to say I did feel safe with the PPE. I think we've been well looked after with that. We've had some really, really difficult times, been a lot of upset and meltdowns, but we've had some positive times as well when patients have gone home. It's been nice. It's nice to see everyone again and to get some kind of normality back.
But this is a very different kind of normal. In order to get his operation, Paul had to take a COVID test and self-isolate for 2 weeks.
I've been living upstairs for the last fortnight. My wife, bless, has been stuck in as well. She's not been able to go anywhere. So neighbours have been bringing us bits and pieces. We had a few days grace before we had to go into quarantine, so we stocked up.
The Trust's worried that requirement to self-isolate's putting some patients off.
People may be just getting back to work. The children may just be going back to school. And because you need your operation, we're now saying you need to do this for longer. I don't think it's a don't. I think it's a can't, or it's really challenging, and maybe the message isn't getting through.
Others are still too nervous to come in.
What's it like sitting in the ward by yourself?
Well, keep myself busy. But yeah, usually you'd be chatting away, but...
Are you nervous at all about having an operation?
No, because I trust them. I do trust them, and I think, plus I want it doing.
Plans are now afoot to turn Burnley General into what's known as a green site, where only patients free from COVID would be treated, so it could continue even if a second wave came along.
So what we need is a safe place. We can basically get on with it. And that's why we're developing the Burnley site. It'll be 7 theatres, 42 odd beds there, that we can continue to basically take on and continue to do the work.
Meanwhile, the rest of the surgical team's expected back from Blackburn within the fortnight.
We're all quite excited about coming back and being able to, it's kind of the new norm of how it's slightly different, but getting back to doing more patients and more contact.
Yeah. Obviously we don't know what's going to happen going forward, but hopefully this is how it's going to be from now on.
Gill Dummigan, BBC North West Tonight, Burnley.